Hello everyone. This is in this oncology class we will be dealing with the prevention, screening, early detection, and warning signs of cancer. So basically, this from the heading itself you can understand. This is a third mm, portion of your syllabus, and here we will be dealing and we will be understanding how we could able to find out the cancer earlier period and how we could able to prevent and what are the warning signs of cancer. Okay, so it's very easy one, and the major topic, that is the prevention, levels of prevention, everything you may heard in the second year in community health nursing itself. You have already studied that topic, so it will be very easier, and this is very simplest topic in this oncology nursing unit. Okay, so first of all, let's see what is prevention. Okay, so prevention, this is the definition that exactly taken from the K Park textbook. Okay, it is the action aimed at eradicating, eliminating, or minimizing the impact of disease and disability, or if none of these are feasible, retarding the progress of the disease and disability. So this is very simple, and I hope you may have understood what is meant by this prevention. This includes some of the action. Our aim is to eradicate, eliminate, or minimize the impact of disease and disability. Okay. Now we are having levels of prevention. So basically there are 4 levels of prevention: primordial, primary, secondary, tertiary prevention. So first one, primordial prevention. This is the simple thing that before the occurrence of the disease itself, this primordial prevention is taking place. And more specifically in terms of cancer prevention, before the exposure to the risk factors itself, we are preventing the occurrence of disease. This is the level, that is the first level, that is primordial prevention. So, it is defined as prevention of risk factors themselves, beginning with changes in social and environmental conditions in which these factors are observed. So, this is the first step or the first level of prevention. So, here the emergence or development of risk factors in countries or population group in which they have not yet appeared. In that level itself, we are preventing the particular disease. And here it is receiving special attention in the prevention of chronic diseases. So that's why this is important in cancer prevention. Okay, we all know cancer is again a chronic disease. So here we have an example of lifestyle diseases like obesity, hypertension. So what they are explaining means in childhood itself, our lifestyle measures have to be monitored and treated or observed, and we have to take more care over the child lifestyle measures, because for example like smoking, eating patterns, physical exercise, weight gain, etc., then only we could able to prevent the occurrence of obesity, hypertension, diabetes mellitus in our later lifetime. So this should be started from the early childhood itself, before the exposure to the particular risk factors. This is one of the example for primordial prevention. Okay. So next we are having primary prevention. In primary prevention, this can be defined as actions taken prior to the onset of disease, which removes the possibility that disease will ever occur. So here what we are doing means we will be preventing or we will be taking the actions prior to onset of the disease. That is, in terms of cancer, we will be avoid the exposure to carcinogens. Okay. Carcinogens means nothing but the substances that causes cancer. So here it signifies as the interventions in the pre-pathogenesis phase of a disease or health problem. Ultimately, it involves the measure to avoid or reduce exposure to carcinogen. So it mainly include health promotion and specific protection. Okay, this thing we have to more focus. Okay. Now this is the entire thing which included in the primary prevention. So we are having 2 parts like health promotion activities as well as specific protection. In health promotion, we are having health education, environmental modification, nutritional intervention as well as lifestyle and behavioral changes we are having. 4 points. In case of specific protection, that means nothing but how we could able to prevent certain diseases through specific methods. Okay. For example, immunization, chemoprophylaxis, use of specific nutrients or supplementations, protection against occupational hazards, safety of drugs and foods, and control of environmental hazards like air pollution, etc. Okay, so this is totally included in the primary prevention. So basically, we have to keeping in mind that these all are the measures, all the measures taken in order to avoid exposure to the carcinogens. Okay, then only we could able to prevent cancer in the primary level. So these are some of the measures that we can simply read and understand what are things you could be able to add up in your future time, especially in your future clinical times as a health education, etc. Okay, so it's easy one. We have to take the measures such as follows. We have to reduce or avoid exposure to known or suspected carcinogens, including cigarette smoke and sun exposure, etc. Have a good diet balance, that is, eat a balanced diet that include vegetables and fresh fruits, whole grains, and adequate amount of fiber. Then we have to reduce dietary fat and preservatives. We have to limit alcohol intake, then have regular exercise pattern, then maintain a healthy weight. Then we have to obtain adequate consistent period of rest in between. So sleep is very important at night. Sleep is the food for our brain. Then eliminate, reduce, or change the perception of stressors and cope with stressors. So stress factors or the stressors must be uh, avoided from our life. Okay. Then we should have a regular physical examination. Then learn and follow the American Cancer Society's recommended cancer screening guidelines for breast cancer, colon, cervical, and prostate cancer. That is, American Cancer Society have been established their own recommendations for prevention of cancer. So that must be taken account, and that must be in your mind that some recommendations have been given by American Cancer Society, and that must be included in your health education part and all. Okay. Then we have to learn and practice self-examinations, for example, testicular self-examination and all. Then we should know the 7 warning signs of cancer and inform the healthcare provider if they are present. Then we have to seek immediate medical care if we notice a change in what is normal or you and if cancer is suspected. Okay, immediate attention to medical care practitioner is very important. So these are some of the important points you can generally add up in your examination purpose as well as your health education purpose. Okay, basically this is included in the primary level of prevention. Okay, now let's have some medical interventions. Okay, so in this picture you can see in specific protection part, immunization, chemoprophylaxis, etc. Some of points have been given. So according to that, some of the medical interventions that we could able to do is chemoprevention, that is use of natural or synthetic agents to interrupt the carcinogenic process, preventing the progression to invasive cancer. So here we will be using some of the natural or synthetic agents to interrupt the carcinogenesis process. And it focuses more narrowly on individuals or subpopulation known to be at increased risk for developing malignancy. Okay, so this will be focusing more on the individual as well as the group who are at high risk for developing cancer. So chemopreventive agents are often nutritionally based. That is, it will be derived from food compounds or supplements. But the food components ingested as part of a regular diet are not considered chemoprevention. So these are separate one, not a part of regular diet. Chemoprevention refers to compounds manufactured into pill, capsule, ointment, or liquid form and administered in prescribed doses at specified frequencies. So, these chemopreventive agents, it can be pill or ointment, capsule, or any liquid that will be administered to people. Some of the commonly used chemopreventive drugs are here. That is, for breast cancer, tamoxifen is there, prostate, finasteride, colorectal, calcium, antioxidants, NSAIDs are there, head and neck cancers, retinoids are there, cervical cancer, HPV vaccines is there, then hepatocellular carcinoma, hepatitis B vaccine is there. So these are the commonly using chemopreventive drugs. Okay. This will be dealing in your next video. Okay.